I'm super excited today to be doing a short video on hormone therapy for men. I've been doing this for 15 years or so now, and I've seen so many good results that I can't imagine not offering this in my practice. Evaluating for this and treating this is so gratifying, both for me and then of course for the patients who are benefiting as well. I'm Joy Vanderlaan. I'm a family nurse practitioner. I specialize in functional, regenerative, integrative medicine. One of the big things that I do is hormone replacement, both for men and women. In the context of hormone replacement, though, we're not just a hormone clinic where we, shoot you full of testosterone and send you on your way. I want to know you. We want to know what your diet and lifestyle is like to be able to help you not only with your hormones, but your sleep and your activity and your diet and your nutrition and all of that to give you the best, healthiest, longest life you can live. So who has these low testosterone levels? What causes them? Well, there's lots of reasons. The first can be medical conditions or medications that people are taking. Certainly age, as we age, our hormone levels tend to decline. And then also the food and the environment that we're in. We are exposed to garbage food. We are exposed to toxins in the air, even so much more now than we were even 30, 40 years ago. And the population's testosterone levels reflect that. It's something like 50% lower, 50% lower now than it was 30 years ago, I believe. So we need to be looking into this and helping men, not only by replacing the testosterone and other hormones as necessary, which we absolutely do, but also then by counseling on nutrition and exercise and how we can avoid those hormone disruptors. So for men, most people are under the impression that libido and erectile function are the two main symptoms of low testosterone. And those symptoms certainly exist. They're often not the first symptoms to show up, though. The symptoms that do show up are a little less obvious sometimes, unless you really know what you're talking about or looking for. Often concentration decrease or motivation decrease is one of the first things to show up. Sometimes it's weight gain, especially fat gain, and then a decrease in muscle mass or decrease in strength. Often this shows up and I see a lot of high performers. So often I see this in C-suite, in entrepreneurs who are very high performers, and suddenly when they are 45-ish, plus or minus 10 years or so, they start to experience lower motivation, lower ability to concentrate, and they get worried because at work, they're worried somebody's going to find them out. They don't feel like themselves anymore. They're getting the dad bod. They're getting soft. They're not as strong as they used to be. They're not sleeping as well as they used to be. And then certainly libido can be affected and erectile function can certainly be affected. So what kinds of hormone therapy are options for men? Typically, what I see most needed and most beneficial for men is testosterone, and then sometimes DHEA, which is a testosterone precursor, if you want to think about it that way. So we can actually replace both of these, and usually what I find most effective and then also most doable and leading to the most steady levels over time is a topical cream of those things. I know a lot of times online you'll read about the testosterone injections, and those are not necessarily bad. However, depending on the frequency of injection, men can then experience an up and down and kind of like a peak and valley of their testosterone levels, which can be felt. Pellets I really stay away from. I've had multiple patients come to me after having just disastrous experiences on pellets. I think one of the downfalls of pellets is that you can take a weekend training course and start doing it, and so the level of entry is very low, and a lot of the providers who are offering pellets are just not highly trained. There are certainly providers who have been doing pellets for a long time who may be doing a much better job. I personally don't think they're necessary. I have found that the creams and occasional need for injections works so well without the risk of the pellets. So what are some of the benefits of getting your testosterone levels optimized, not just in that quote normal range, but optimized for each individual, optimized for you? Well, energy levels certainly, and then muscle mass, which leads to better glucose metabolism, which leads to lower risk of diabetes and better energy and function and enjoyable and vitality in life. And so this is often a big draw for men, and they don't realize how bad they felt until they get on the testosterone and realize, oh, I could have been feeling this good all along. I wish I would have called you 5 years ago. I hear that kind of thing a lot. So there's so many benefits to be gained, both benefits that you can feel now, like libido changes and better energy, better cognition and concentration, but also benefits for later, including muscle mass, super important for longevity, and then bone mass, bone density. So many benefits both now and long term. So it's really wise to get those levels checked if you're experiencing any of the symptoms that I mentioned earlier. Certainly there can be risks to anything that you do. I would not want to start a man on testosterone therapy if there were things like unresolved or severe sleep apnea, for example, or if they were still smoking. Most of my patients don't smoke. By the time they come to me, they know they're not best off smoking, so they've quit already. But there's certain situations where we want to evaluate and maybe wait on the testosterone therapy until a few other things are in place. Now, on the other hand, if a man is overweight and has sleep apnea, and losing weight is going to help sleep apnea, but he can't lose weight until we get testosterone on board because he's going to have to build muscle in order to lose weight, and he's going to have to be motivated in order to make changes in his life such that he's going to lose weight. Sometimes it can be appropriate to start cautiously on some testosterone and monitor maybe a little bit more closely than I would in an otherwise very healthy person. What we really do well at Nourish House Calls here is provide individualized care and then monitor care over time so that we can do things like check on levels, check on symptoms, make sure that we're optimized. The dose for you at the beginning of therapy may be higher or lower than what you need a year in, or 2 years in, or 5 years in. And so we also want to make sure that we're doing nutritional testing and stool testing, GI testing if it's appropriate. We want to make sure that the metabolism of the hormones is going well, that for instance, you're not metabolizing into DHT and getting all kinds of acne on your back. I've heard that from hormone clinic patients before. Well, they just told me it was part of the therapy is having bleeding acne on my back. Please don't accept that as good treatment. None of my patients are getting acne on their back and they're having all the benefits from testosterone. So please, if it feels wrong to you, it probably is wrong. Probably find somebody else who's willing to give you a more individualized approach to hormone therapy. If you're really looking to dive deeper into testosterone therapy for men and the benefits and the risks, a book that I recommend is called Testosterone for Life by Abraham Morgentaler. He's a wonderful speaker, wonderful doctor, I believe on the East Coast. I've been to a few conferences where he's spoken at and been so impressed with the level of research that he's done. And he truly is an expert in the field. And so his book is a really good resource if you're kind of looking to dig deeper and have some of these more sophisticated questions about testosterone risk and benefit answered. So I hope this has provided you with kind of at least a surface level understanding of hormone therapy and how we approach it at Nourish House Calls. Very individualized, going for optimal levels rather than just normal levels, and then really caring about the individual as a whole, not only their hormone levels, but also nutrient levels. We do a whole comprehensive nutritional panel. We want to know about digestion and sleep and activity and really address all those pieces of the puzzle to make you feel your best and make sure you live a longer, healthier life. You can book your discovery call if you're curious about treatment with us at our website, nourishhousecalls.com. We offer a free 15-minute discovery call where you can tell me a little bit about what you're looking for, and then I can ask you some questions to make sure you're going to be an appropriate fit as a patient here, including what states I'm licensed in, which again is on our website. So I look forward to speaking with you if you need help with your hormones or really anything else functional medicine related.